Thus, a familiar theme that ushers in views on health. Good evening and a warm welcome to the program. Tonight, it's a great pleasure to have with me Dr. Chiranthi Liyanage, consultant in rheumatology and rehabilitation and senior lecturer at the Faculty of Medicine, University of Colombo. Welcome back to SLB Sena program, Doctor. Pleasure to have with you.
Thank you very much.
With us, thank you. And for the information of our listeners, the topic that Dr. Chiranthi Liyanage is going to focus on is chronic back pain. Over to you, Doctor.
Thank you, Fatima. So I thought it would be good to talk about back pain, and particularly long-standing back pain, because we see a lot of patients, a lot of people, both young and old alike, coming with this problem, and it's quite distressing as well to the patients when they get it, and particularly when it happens in a younger age group, it disturbs the activities, and we see it often in adolescents and children as well, with the change in lifestyle. And then as we grow older, these problems become much more common, with the change in our lifestyles, with the change in our habits and posture. So I thought it would be quite important to talk about it for the benefit of our listeners.
So it starts pretty young. I mean, say children, adolescents, young adults, and of course, the older we get, we are prone to these medical conditions, medical issues that we face. Mm-hmm. But when you say children and adolescents, it's quite alarming, Doctor.
Well, it's although it sounds alarming when you put it across like that, often what we see is due to posture and mechanical issues. Now, in this day and age, everybody is on a screen. And you have seen the size of the school bags our children have to carry, and the fact that they stay seated for a long period of time in the classrooms, and then they go for after-school classes, and there's a huge change in the lifestyle from what it used to be, even from what I have grown up with. So because of these changes, these musculoskeletal and joint pains, the chronic aches and pains, are becoming much, much more common. Mm-hmm. And when they develop it at a young age, they're more prone to have continuing pain when they're growing up and going into adulthood. So it's important for us to tackle it at a younger age, to correct the posture, to correct these changes in lifestyle, so that we don't get it in children. And it's not something that would it's not like an arthritis that would leave you disabled, or that would make your joints go disfigured, but it is still pain, and nobody likes to be in pain. And when you get pain, it invariably affects your quality of life and what you do. So what we see in children and adolescents is primarily this back pain, neck pain, and shoulder pains. That's got to do with studying for a long period of time, and bad posture, and inappropriate school furniture, the desks, the chairs, and even at home, sometimes when they do have a proper chair, our children don't sit in the proper way. Either their feet are up, or they're slouching forward, or they're in the bed studying. So these things make back pains, shoulder pains, and neck pains much, much more common. And once you get it, the thing about pain and how our bodies perceive it is that when you get pain, particularly pain arising from a muscle or a joint, the body thinks that there's an injury. And with that, the body tries to prevent movement around that joint or involving that muscle group. So how does the body prevent that? The muscles go into spasm. And when the muscles go into spasm, there's more pain. So that goes as a vicious cycle. So we have to break that cycle at some point. And to break that cycle, so that's children and adolescents. And when we come to adulthood, a lot of us are doing either desk jobs or sedentary jobs, seated in front of screens for a long period of time. And then again, if our office furniture is not good, the chairs are not good, or if your screen is at a lower level, particularly if you're working on a laptop, you tend to stoop forward and the screen is not at eye level. That can also predispose to these musculoskeletal aches and pains. And then on the other hand, with this sedentary lifestyle, a lot of our population are overweight or obese. And that also predisposes to these chronic aches and pains that are arising from muscles and joints. So although it's not a disease per se, it's a huge problem that causes significant distress and also disability. So as I was saying, it's important to break that cycle and correct it.
Thank you, Doctor. Now, interestingly, school children and their backpacks.
Yeah.
Yes, they're quite loaded, quite heavy, I must say.
Yeah.
But they have no choice. How can they kind of relieve, the burden of carrying so much of weight?
So much of weight. Well,
they can't carry 2 bags.
Exactly. Good question, Fatima, and I don't know whether there is a good answer to that, but the sensible thing would be to use the proper type of a backpack. For example, the one with 2 straps, and adjust it to the right size so that it's not either too low or too high, at the correct size. And backpacks with a waistband around that helps to sort of distribute the weight is also better than, single pack. But what we see in kids is even if there are 2 straps, they wear it only on one shoulder. So then there's a maldistribution of weight. And always if you're carrying a lot of heavy books, it's always good to have the backpack rather than like a side satchel or a bag that you wear on one shoulder. So, and I suppose the other thing is to be a little, I would say a little sensible and sometimes a little crafty. If you can leave a few books behind in school or a locker rather than carrying it every day in and out, or come up with little things like that to relieve the weight, and also use the proper bags and also proper footwear as well. Those things would help, certainly.
Thank you, Doctor. And going on from there, a question that I would like to ask you is that when you say that you see young people putting their feet up, how does that work? I mean, in the sense, how does that impact negatively on their muscles and yes. So if you're seated, the best way to be seated is with your back straight at 90 degrees, hips at 90 degrees, knees at 90 degrees, and ankles at 90 degrees. That's the more ergonomic way to sit. So if your feet are up and you're seated on a chair, obviously there's a strain on your back and your back muscles. So these bits of muscle strain will lead to little sort of, what we call micro trauma, and that will lead to pain. And the same thing if you're slouching forward, if your back is not straight and well supported. So because of that, it's very important that your school furniture as well as your office furniture are proper, are of are ergonomically sound, and also that you maintain your posture properly. So there are little things that you can do. For example, if you are a fairly shorter person, it's always, if you can adjust your chair height so that your feet are firmly planted on the ground, that's good. If you're taller, put your chair up a bit. And when you're working on a screen, if you can elevate the screen, it could be as simple as keeping a stack of books underneath your laptop just to elevate the screen so that you don't have to stoop forward to look at the screen. So those kind of little adjustments can take the strain away from your back, your neck, and your shoulders. And if you do get pain, then it's also important that we tackle it quickly. Because if you let the pain linger, it will turn into a chronic pain. So sometimes we have to, when we come across people who come and complain of
back pain or shoulder pain or neck pain, one of the first things that we need to do as rheumatologists is figure out whether this is a mechanical problem related to posture or whether it's something a little bit more serious like an arthritis involving any of these joints. And once we have determined that, then we have to dig in a little bit deep and find out why exactly are they getting this pain if it's a mechanical in nature. And so we often have to ask them what do they do during the day, for how long do they stay seated, what their occupations are like, etc. And then we have to correct those risk factors, and we sometimes have to use medicines to get rid of the pain as well as the muscle spasm. But those are always for a short period of time, and that's not the cure for the entire thing, because why they have got the pain is because of bad posture and bad practices. So we always have to correct that. So in addition to giving medicines for a shorter period of time to get rid of the pain, we often advise on exercises to strengthen the muscles as well as to correct the posture. So we sometimes have to get the help of physiotherapists to do these things properly. Sometimes we get the help of exercise medicine specialists to make sure that they learn the correct posture, they learn the correct exercises, and then do it. And I have often been asked of whether they really need to go to a physiotherapist. Do I really need to go and see this person? The answer there is, as long as you know what exactly you're doing, as long as you know what's the correct way to do it, it's fine. But if you don't know what you're really doing, if you're just assuming that this is what I should do, that could do you more harm than good. Because if your posture and positions are not correct when you're trying to exercise and strengthen your muscles, you can get injured, your muscles can get strained. So it's always a multi-pronged approach that's needed to tackle this problem.
Interesting, doctor. So the problems actually begins when they are young, through bad posture or maybe carrying weight and not distributing it properly, and putting the strain on your back and then affecting the muscles. So it starts when they're young.
Yes.
And the damages set in.
Yes, the damage as in the posture is something habitual. So it does start when you're young, and particularly if you're overweight, again, that affects your posture as well, particularly the back and a little bit of what we call the lordosis, and also our footwear. And of course, we all love to wear high heels, but that does change our posture. So all these things do contribute.
But wouldn't you say that, occasionally wearing a stiletto or something, a high heel wouldn't actually harm? I mean, it's not a regular thing.
Yes.
But if you're working and every day you're going to office and coming back, and then you obviously, and you're doing a bit of walking in the midst of your work in your office, whatever, then you have to have sensible footwear. Yes.
So you need to, we can't always ask everybody to wear flats or sports shoes, particularly if you're wearing saris or something like that. So as you were saying, it's important to be sensible. And the other thing is, even if you're wearing a high heel or a stiletto, let's say you wear that for 6 hours a day, if you can take them off for for a few minutes, and if you can stretch, if you can exercise, if you do the right things to counteract that, even after getting home, or during the day if you're seated at a desk, that would also help. So we can't expect everyone to give away what they like, but you need to be sensible and do something to counteract the muscle strain and the spasm that happens because of your habits.
Thank you, doctor. Because that's interesting. As like in other lifestyle modification. I mean, while you're working, you may be able to remove your shoes for a while and just be bare feet.
Exactly.
And maybe stretch your feet or toes, exercise a bit, and give yourself a break, and then you need to get up again and go, you may wear your shoes.
Yes.
So one has got to be conscious of that.
Exactly. And the other important thing is when people get these aches and pains, some get very alarmed because they think that could be something very serious. My advice would be that it's always best to get assessed by a doctor who has the skills and the knowledge to properly assess you and figure out what exactly is causing it. Because sometimes we see patients who are actually just having these mechanical issues, either due to bad posture or either due to a small alignment or a small issue in the alignment of your joints, who are on long-term medicine for arthritis for no real reason, without getting a real benefit out of it. And on the other hand, we see patients who do have an actual arthritis who are not diagnosed, who are underdiagnosed, who are on either just topical treatment or certain complementary medicines, etc., in whom this joint damage is ongoing because they actually have an arthritis. So if you do have issues, you do get long-standing back pains, particularly ones that are really bothering you, the pains that affect your life. It's always important to get assessed, get it looked into, and then figure out which way to go. Because none of these are actually good for you in the long run.
So, doctor, when you say chronic back pain and you're treating it, does that lead to arthritis?
No. So it depends on the reason. As I said, if it's just mechanical, if it's due to bad posture, that in itself won't lead to arthritis. But as we get older, this type of arthritis that we call osteoarthritis, that is due to wear and tear. That's sort of just a degenerative process that goes on in some joints. And there are joints like that in the spine as well. So those can also set in as you grow older, but it's not really due to the mechanical, pains that you've had. But if you've had a bit of trauma, then it's more likely to set in. So it's not really that it leads to arthritis, but it's that osteoarthritis is so common that when a certain proportion of people get older, they can have osteoarthritis that set in even in the joints that occur in the spine.
So take the word chronic and the back pain. So if it sets in, you got to put up with it.
No, not really. That's the main message. If you find out what is really causing it and we can correct it, then you can get rid of it. Why it keeps on coming back is because we have not corrected the root cause. We have just given some medicine to get rid of the pain, but then the minute you go and go back to your normal posture or doing odd things, lifting weights in an awkward position or sleeping in an awkward angle, the pain will set in again. So that's why I said, Fatima, that it's very important to find out why. Why is this person getting back pain and correct the real reason for getting back pain.
However, is medication part of the treatment?
Yes, definitely. If, as I said earlier, when you get pain, the body thinks of that pain as an injury, something injurious, something not good. So the body tries to prevent movement around that area by sending the muscles into spasm. So when the muscles go into spasm, they become tender, they become painful, and then you feel more pain. So it just goes on like a vicious cycle where the pain just perpetuates and gets worse and worse. So we have to give medicines to get rid of this pain. And often, sometimes we might give tablets which are essentially painkillers. Sometimes we use topical treatments like creams and gels. Sometimes we do give muscle relaxants to get rid of the muscle spasm. So medicines do play a role in getting rid of the pain and the muscle spasm. The other reason why we might use medicines is if there is some other definitive underlying reason for the person to get that back pain. For example, if there's an associated arthritis or some other reason to get the back pain as well. So yes, medicines do play a role.
And then it will be a continuous process?
Yes.
Or would there be a break? Because this condition can improve?
Yes. So medicines generally for posture-related conditions, they're only for a short period of time because it's just to get rid of the pain. The rest will be with exercises and posture correction.
Comes back to that.
It definitely comes back to that. And that again, now when we get used to a habit, it's quite difficult to break that habit as well. So it might be a bit of a long drawn process, but then once you have got used to it, once you are sort of sure, and once you have really, once the correct posture and things that you have to do are really ingrained into you, then you really need not continue with a therapist or even a rheumatologist, and it can be very, very infrequent sort of follow-ups. But initially, it will be important to have regular follow-ups and get things corrected.
Thank you, Doctor. Very interesting, and the time is catching up with us. So what would be your take-home message?
So my take-home message would be that, number one, these chronic back pains, shoulder pains and neck pains, they can set in childhood or even adolescence with the change in lifestyle and the change in behaviors that we are seeing. So it's important to correct posture, to correct the ergonomics, correct how we get on with our lives, to make sure that it doesn't set in. And if it does, if you do have long-standing back pains, neck pains or shoulder pains, it's always important to get evaluated, have that looked into to figure out why exactly that you're getting it. 80 to 90% of people that we come across, it's due to bad posture or mechanical issues. Only a very, very sort of small percentage actually have an ongoing arthritis or another serious condition. So the ones who have the mechanical pains or pains related to posture are always correctable with short courses of medicines to get rid of the pain and the muscle spasms, and with proper exercise and posture, it's always correctable, and you can always make sure that it doesn't come back if we can sustain those changes.
Thank you, Doctor, so much. So, of importance is correct posture to begin with, and if that is practiced, maintained, most of these problems won't be there. Yes. Am I right in saying that?
Exactly, Fatima.
Thank you. That's comforting to know. And there we end this very interesting discussion on chronic back pain. Thank you to you, Dr. Chiranthi Liyanage, consultant in rheumatology and rehabilitation and senior lecturer, Faculty of Medicine, University of Colombo, for being with us on the program and discussing an interesting topic with our listeners, chronic back pain. Thank you, Doctor.
Thank you for having me.
Thank you also to Sandaruwan Liyanage for technical assistance. I'm Fatima Razi Kada saying good night and looking forward to your company next Monday same time on Views on Health.